Welcome to another episode of The Pack Breakers, a show dedicated to tobacco harm reduction and the people of tobacco harm reduction. Today we have a very special guest, but before I move on to introducing our guest, I'd like to just advise everybody or speak to everybody around our new survey, the 2025 Vapor Survey of South Africa. It's very important that we have this data collected. Your experience is our knowledge. And then we use this information to help us understand the trends and what's happening within the South African space. It'll also help us, raise awareness around who's using these products and why they're using these products. So we'll put a link in our description bar of this video, and you can see in our socials links to this particular survey. So please, if you have 5 minutes, please take the time to engage with the survey, fill in the answers, and share it far and wide. Thank you very much. And now for our guest. I must be honest that I've been very privileged to attend some of the conferences around the world with regard to tobacco harm reduction, and I get particularly excited when I see this particular individual going to be there in order to give a discussion or have a speech. And I must be honest, I've left every one of those conferences a little bit disappointed because I haven't had the opportunity to go up to this gentleman, shake his hand, and thank him for all the work that he has done over his illustrious career. Our guest is Dr. Derek Yach. He's a distinguished global health expert with 30 years experience in public health and advocacy and policy development. He served as the former executive director of non-communicable diseases and mental health at the World Health Organization, where he played a pivotal role in the creation of Framework Convention of Tobacco Control. As the founder and former president of the Foundation of the Smoke-Free World, Dr. Yach has been in the forefront of initiatives aimed at reducing smoking-related harms and improving the health outcomes worldwide. He's an academic, and his credentials, including degrees from University of Cape Town, Stellenbosch University, Johns Hopkins University, along with an honorary doctorate of science from Georgetown University. Currently, Dr. Yach works as an independent consultant focusing on the chronic disease prevention, mental health, and innovative public-private partnerships to tackle complex health issues. I now welcome Dr. Derek Yach. Good morning, Dr. Yach.
Good morning, and wonderful to be with you.
Thank you. Thank you so much for taking the time to be with us. And you just told me now that you've come back from a swim. Your Twitter handle is Swim Daily. And you were saying that you were swimming in -5 degrees and the water temperature was 3. Is that correct?
Yes. Yeah, we have a bunch of us here who swim throughout the year. And as the temperature drops, we swim in the reduced temperatures, and it goes down to 0 by early February.
My word, that's just, I can't even fathom that. Dr. Yach, I think what I want to do is take a 10,000 foot or helicopter view around tobacco harm reduction. Given with what you've seen over the decades, why do you think tobacco harm reduction is such an important concept or initiative or even an approach to what we've been struggling with regards to tobacco in the world?
Well, I think that we've tried a full armamentarium of taxes, regulations, education programs, and even pharmaceutical-delivered medications. And while they all have their effects, the rate of improvement is stunningly slow. And we still have well over 1 billion people who use tobacco products in the world. And as probably many people listening know, that there are over 8.5 million people dying needlessly every year. It remains the largest single preventable cause of death, and I almost get tired rolling that off my tongue because it should no longer be that. What harm reduction does, I think, first of all, from the product side, it introduces products that the smoker and the user of smokeless tobacco find more appealing. They address many of their needs more effectively than a medicated solution. And they allow people either to switch to a reduced risk product if they want to, or quit completely. people often forget that the origins of harm reduction actually begin when one tells somebody to smoke less. That's harm reduction. We stopped saying that to smokers way back, even when I was at WHO, for fear of them getting the sense that cigarettes could in fact be fine. And our mantra was, any cigarette is one too many. Whereas the reality is that if you're smoking 20 plus a day compared to 2 or 3 a day, your risk is dramatically different. The next big phase, besides saying smoke less, was when we had people like Mike Russell, originally coming from the University of Cape Town, the Department of Psychiatry, went off to England and became one of the inventors of the first nicotine products that were used in patches and gums. And it was him who said in the late 70s, we smoke for the nicotine, we die because of the smoke. And that started the whole movement towards medication. When you saw that, you realized there was a means through medicated solution to lower the death rates. But as I said, the pickup, the impact has not been all that great. So when we started seeing advances in the technology of separating the nicotine from the toxic stuff, first in vapes, then in heated tobacco products, increasingly in nicotine pouches and snus, and now across the Middle East in e-shisha products, I believe this represents one of the biggest overall potentials of lowering the death rates fastest than we've ever seen.
So I've always said, and we've, vapes, because particularly this show concentrates on vapes, but vaping or e-cigarettes, would you agree that they are significantly less harmful than combustible tobacco?
They are absolutely dramatically less harmful. And we have the evidence of that through massive reviews of the Food and Drug Administration of the US, who've licensed a number of vapes exactly on the basis that, in their words, they are appropriate for the protection of public health, which means they have to reach a high standard of being substantially less harmful than combustibles and likely to actually reduce people's long-term risks of the tobacco effects. Many other studies over the years. The simplest way to actually check this is to look at the exposure. What comes out of an e-cigarette and what comes out of a cigarette is dramatically different. The levels of nitrosamines, of toxic metals, and so on. Study after study shows you that you're dealing with very low levels of exposure in an e-cigarette or vape, whereas you're dealing with toxic and dangerous levels in a cigarette.
So why do you think there's such a disconnect? Because we'll see, for example, that the World Health Organization and even the South African National Department of Health are so adamant that these products are not as safe as what's being reported. In fact, sometimes that they even indicate that they probably could be more harmful. Why is there such a disconnect of what we're seeing in the science and what we're seeing from messages coming out of certain health departments, as well as what I've seen from the World Health Organization? Why is there such a disconnect?
I think it goes back to the distrust that we had decades ago about anything said by the tobacco industry must be thought of being either a lie or falsehood. And there were some major debacles many decades ago. One of them was the hope that low nicotine or low tar cigarettes would actually give all these benefits, which it turned out they didn't. And they thought that was a trick by the industry. The second, I think, is that there's the very widespread distrust of the tobacco industry in general, which makes it almost impossible to actually have a dialogue with their scientists and their researchers. If they did, they would actually see fairly dramatically the high quality of work going on, and we can talk about that later. And then added to that, we had the incursion of one of the world's most significant philanthropists in the area of global health, Michael Bloomberg, putting up $1 billion, $1 billion, for a range of projects and studies and research aimed at trying to make sure that vapes, alternative products, are all banned, restricted, prohibited. And that includes funding directly to the World Health Organization. we must remember that he sits as the ambassador on non-communicable diseases. He also funds the body, the regulatory body at WHO that decides on the norms and standards. And they've obviously ruled against vapes and particularly nicotine pouches in recent times. And then through the Campaign for Tobacco-Free Kids and a myriad of projects around the world, funds a very well-designed campaign where the main message is it's all about the kids. We have to worry about kids vaping. That is the preeminent concern. If kids vape, that is really bad and inherently terrible. Never do they talk about the benefits to the adult smoker, where there would obviously be substantial benefits. You put that together, and a cabal of nonprofits, of academics, have been funded and supported and been heavily brainwashed by disinformation campaigns over the last decade, to the point that many of the strongest public health researchers who may get funding from industry or may have some association, their voices are not heard in many of the conferences. In fact, they're banned. The Cape Town World Conference was held a few years ago. Most of the people who have strong voices against tobacco harm reduction were banned, restricted, or prohibited from taking part, including myself. The next one coming up in Dublin next year, where the world is bringing together the experts of tobacco control, will only have some of the experts because those who are actually advancing tobacco harm reduction don't have a seat at the table. Many of the journals, particularly those under the British Medical Journal ambit, have banned or prohibited people from even submitting articles giving a contrarian view. Luckily, they're a minority on the journal side. Articles get rejected. Research gets turned down on the basis of arguing for tobacco harm reduction. So we know the dangers of actually having contrarian and anti-vaccine views and the effect it has on health. We don't talk enough about the fact that there's a similar, very rigorous, very well-funded and organized campaign to make sure that the public, the researchers and the policymakers don't have easy access to tobacco harm reduction. The paradox, of course, is that some of the bigger countries in the world are the ones which regulate the product. They don't ban it or prohibit it. We know the US FDA has a range of ways in which it actually supports and acknowledges and authorizes a wide range of products. And if they're appropriate for the protection of public health of Americans, they must be appropriate for the protection of everybody's health. The Chinese government, we don't talk about enough, and China is the home to the manufacture of 95% of all the vape components in the world and most of the heated tobacco products. The Chinese government has not banned or prohibited vapes. They regulate them, but a regulated market is what many people want. And increasingly, you're likely to see a wide range of vapes on the Chinese market, the largest market in the world, potentially. And I could go on. We're starting to see other parts, particularly in the Middle East, where there were bans and prohibitions, and they're now reversing them, recognizing the value to human health. So this effort by WHO to stop the progress is not going to succeed. And at some point, they're going to have to stand back and take a relook at the evidence and recognize that the benefit far outweighed any of the risk.
Well, absolutely. I mean, and it's if we look at a recent meeting that I think you presented at, where some of the information that was provided by our own health department or people speaking on behalf of our health department, it was actually quite alarming, some of the statements that were made in that particular meeting. But what makes me even more anxious or concerned is that if we look at the kind of research that, for example, the South African Medical Research Council have conducted, they tend to look at cross-sectional observational studies with a high degree of selection bias. A great example is, for example, the university, looking at university students and looking at their vape habits. And there was another scenario where they were looking at the location of vape shops to universities. But then certainly don't look at the actual product and what the product is doing for individuals that are using the product. And they certainly don't look at it from a representative, a South African representative point of view. I mean, one of my heroes in the South African space, and people laugh at me when I say this, is Professor van Zyl Smit. And the only reason why I consider him a hero is because he does have a cessation clinic at Groote. So he is definitely in the game of trying to help people quit smoking. And he just recently released a study looking at youth vaping. But unfortunately, it looked at a very, very small select cohort that are affluent or come from affluent homes. And therefore, it's not very representative of the South African story. Now, I understand that we don't want the youth to vape, we don't want the youth to smoke, and we try to do as much as we possibly can to prevent them from getting that. But we also have a far greater population of poor people that currently smoke. And they tend to be forgotten in this entire debacle between what's good and what's bad and whether we should vape or shouldn't vape. Those individuals are just left to their own devices, which is what breaks my heart. How is South Africa getting this so wrong?
Well, I think South Africa has been, I obviously come out of that environment. All my work at the MRC and way back, did actually try to build a strong culture of research in the field. I think if I listened to the NEDLAC meeting in the way you did, there are a few things that stood out for me. First, the majority of the questions and the concerns coming from government were related to kids. There was no questioning of the potential of saving the lives of adults, and particularly adults with early disease, whether it's tuberculosis, schizophrenia, cardiovascular disease, and so on. I thought on the youth side, if any of the government representatives had been listening carefully to Clive Bates's outstanding address on demolishing the gateway and reminding us that vapes are gateway to nowhere, which is a well-known statement by many of the leaders here, and based on the evidence, the hard data. That was the first concern. The second concern was that there was a lot of anecdotal evidence being presented. And as you said, I'm trained as an epidemiologist, and I've argued right through my whole career that if you're trying to look at the relationship between A and B, doesn't matter what they are, cross-sectional studies are always going to be fraught and problematic. You have to do the more expensive long-term study and follow what happens over time to unravel whether A precedes B in time. We know we've had many publications, for example, suggesting that e-cigarettes cause cardiovascular disease, where the cardiovascular disease, the e-cigarette use started after the cardiovascular disease was actually detected. I mean, those kind of basic errors, unfortunately, are fraught across the quality of tobacco harm reduction research. And a colleague of mine I actually supported when I was at the foundation to do a major review of the methodological problems. Coming back to South Africa, I think that there's a recent review out on a decade or so, or maybe 2 decades of tobacco control research in South Africa. And since I know the work particularly well from the period I was involved, what strikes me is that in the tobacco harm reduction area, we have very little research of policy relevance. The research we do have tends to be looking for the problems of vapes in kids. We have virtually no efforts to look at what would vapes do in a tuberculosis clinic or in a mental institution. And why I mentioned those two just to start is that people don't recognize that, first of all, I think you all know, TB in South Africa is still a big problem. 270 to 300,000 new cases a year is a big number. Of those, about 70% smoke. And this is based on data that colleagues and I did a decade ago and hasn't changed much. So 70% of people with TB at the point of diagnosis smoke. So the question then is, a year or two after their treatment, what percentage are still smoking? And the answer is the same. So we have Professor van Zyl-Smit, a well-known pulmonologist, as you said, from UCT, who would be seeing a lot of these patients. The question is, why is he not directing his team to focus more on alternatives to getting tuberculosis patients who smoke COPD patients who smoke to actually switch to things that we know from the UK and US studies will actually work far better than nicotine replacement therapy. I don't know. Why is the MRC not funding this kind of research at a time when we've still got very high levels of smoking rates, particularly among vulnerable, poor people with early disease? I think it's going to take a real effort to get it happening. And the onus then it falls to industry to do some of the research. And we know we've got distrust of the quality of the industry studies. Very importantly, I hosted a meeting in September last year at the Harvard Club of New York, which brought together some public health research experts and some people from industry, the industry scientists. And it was a meeting held under the Chatham House rule, which means I can't tell you who was there, but I can tell you the outcome. And you had many leaders from across the tobacco industry research world and public health research. The question on the table was, what will it take for the industry and academic researchers to talk to each other, to share their methods, to agree on what really matters for high quality research, so that after a study is published, you don't have people quibbling about the results, rather have the debate at the point of methods. And there was consensus that that is the way we need to make progress. I would love to see the same thing happen in South Africa, where the tobacco control researchers meet with industry and they could find ways to have a safe space to make sure that all they're talking about is science and the quality of methods. Then let them design studies to look at what works in the setting of a TB clinic or in a mental health institution or in a cardiovascular clinic. I mentioned in the case of TB that 70% of people with TB smoke. The same is true of schizophrenia. And we know that because the smoking rate is so high in people with schizophrenia, they die 10 to 15 years younger than people without schizophrenia. Yet there are virtually no studies being done to actually improve cessation. I supported work on this in the UK when I was in the foundation, where we funded a group working at the Priory Hospital, which is the largest hospital for profoundly mentally disturbed patients with schizophrenia, mental health issues, and so on. The end result was the acceptance of the psychiatrists to have vending machines for vapes in the hospital, knowing that particularly the vulnerable mental health patients don't like the patch, they don't like the gum, and yet they're being told to stop smoking. Often the pressure to stop smoking leads them to do one thing, commit suicide. And that's why this is not a theoretical soft issue. It's an issue one has to think of carefully, particularly in these vulnerable groups.
And also, I mean, I look at our proposed bill and I look at, we actually haven't solved the problems of smoking at all. In fact, I believe some of the policies that we've put in place have actually made it worse, particularly around taxation. And I've heard arguments around if we increase the tax on, for example, cigarettes, all it does is it moves the market to an illicit underground environment. And I have a belief that although we might see headlines coming from UCT's REAP program that we're losing X amount of billion rand because of the revenue generated from the tax of the cigarettes, I have a strong belief that the people that are buying these illicit cigarettes, who now can buy a pack of 20s for 12 Rand, as little as 12 Rand, are now smoking more, which then is the reverse of what we've been talking about harm reduction. And it scares me is that we're now trying to introduce a new bill, which I'm not going to stand in the way and say we shouldn't regulate vapes, but I'm just concerned is that where are we actually going to reach a point of pragmatism where we start addressing individuals we don't have any cessation support to speak of in the country. We don't provide nicotine replacement therapies. We don't even have cessation counseling in our primary healthcare centers. And we've basically been told, I mean, I'm a former smoker. I smoked for 20 years. I smoked 40 cigarettes a day. I've lost both my parents to smoking-related diseases. I've lost my grandparents, or my grandfathers, and many of my uncles and aunts. In fact, to such a degree, at the age of 50, I am now the fourth oldest member of my family. And it's all due to smoking. And I can tell you with my hand on my heart that every single one of my family members wished they never smoked. and wanted to quit. And every single one failed to quit. And there were multiple attempts. And that's what my story was all about, is that I tried for 10 years to quit smoking. And it was only when I was introduced to vaping products that I was able to succeed. And that's 11 years ago. And I just worry, where's the pragmatism around this? I mean, there was my wife coming from a medical background and working in places like Baragwanath and Charlotte McClellan during the HIV/AIDS scenario. We suddenly realized that we need to have pragmatic solutions. But when it comes to people who smoke, we kind of have been programmed, I'm talking from a societal point of view, that they can be ignored. They can be, that they do dirty things. That's a dirty habit. We can ignore them now. Hopefully we just won't need to deal with them. That really concerns me. And I now believe if we look at some of the studies and some of the rhetoric that's coming out of the MRC and coming out of related schools. I mean, the Heart Foundation, Stroke Foundation, cancer, all that. I'm now getting really concerned that we're now approaching what I would term public health malpractice.
Yeah, no, and I think you're right. What is also interesting, particularly in a South African setting, is that there's a deep insight into the value of harm reduction in the fields of HIV/AIDS, or in motor vehicle injuries, or even in physical activity. And South Africa is home to Discovery's Vitality. What's the whole premise of Vitality? It isn't to get to perfect health and perfect habits overnight, but to take an extra 1,000 steps a day. Cut a little bit out of your diet. Make sure you get screened. These are all incremental things. These are all harm reduction measures. We need to apply that in the field of tobacco, where, as we know, a shift to one of the harm reduction products may not bring you down to a risk level of 0. That's going to give you pretty close. And combining some of them, I think if we look to other countries, we should also, because we could get very depressed and upset, but let's look where we're seeing real success. So certainly Japan, where we've seen a cut of 50% of male smoking rates in a country people never thought this would happen, driven predominantly by the access to heated tobacco products. Across the UK and the US, we're seeing similar data driven by the vapes. Across Northern Europe, we're seeing it driven by snus and nicotine pouches. And now even across countries where it was very difficult to make progress, Pakistan and so on, we're also starting to see progress. So I think that the data is so compelling. The question is, when will somebody in government have enough courage to actually say we simply needs to get on and support it? Remember that for many years, there was denial about the value of antiretrovirals, going all the way to the president. And it took a big push to finally get that overturned, which reminds us that government can be profoundly wrong and damaging to people's health. There have been studies done by colleagues at the MRC and UCT looking at how many people died needlessly because there was no access to antiretrovirals at a time when the world evidence was overwhelmingly in favor. Well, I followed the same logic with colleagues, and we've been calculating how many lives in South Africa would be saved if we did get people to shift to harm reduction products. And our estimates are at least 1/3 lives would be saved between now and probably the early 2060, beyond what would be expected if we continue along the current course. That's a huge benefit to health and to people's, and lives mean populations and families and communities and everything else around them. So I think the problem is no longer that we don't have the data. The problem is the mindset of the leadership. And one hopes that maybe there were some positive aspects of the Ned Lack book. I think if they listen to some of the strong evidence, Praneep Vallabhya gave, I think, an outstanding talk from the University of Western Cape. He has sat on this data for years, understands very deeply. We have other colleagues in South Africa who've also very aware of the data. Some of them are, I think, just scared to actually stand up. When I was at the foundation, I supported a number of groups in South Africa doing long-term studies looking at what happens in the context of COVID. Many of them were forced to return their money or break off all links, and threatened with all sorts of academic pressures because they were working with a foundation where the original funding happened to come from PMI, even though PMI had zero influence on the course of the research. That's the reality we're facing. You might also recall that we had the same debacle around nutrition and the positive and negatives of paleo diets and keto diets and so on. So South Africa has known the importance of open dialogue to promote health, and it's never easy. My own hope, and I say it when I speak to any country, is that we're not saying that you have to make a sudden switch overnight on the basis of what outside people are telling you. You have inside the country enough expertise to have a commission to review the evidence based upon what we're seeing worldwide on the science, on the exposure. Speak to the FDA. Ask them, why has the FDA continued to authorize more and more products, from vapes to nicotine pouches to heated tobacco products? What is the underlying evidence? Because they are regarded as the premier regulatory body in the world. You accept their advice when it comes to vaccines or new pharmaceutical products or medical devices. They have the same rigor when it now comes to an assessment. They may be far too slow, which they are, far too slow. But in the end, if they make a decision, the decision should apply to products that should be sold in the South African market as well as in the US market.
No, absolutely. I mean, it is. It boggles the mind. Is that if we think about our approach to HIV and AIDS, and yes, I mean, there was that denialism that caused the death of hundreds of thousands of South Africans, the premature death of hundreds of thousands. I mean, the whole debacle around Navarapine and transmission from mother to child.
Yeah.
And then we look at our approach to addressing this subject from a social point of view by introducing the free condoms into the equation and even having these condoms made available at schools. And these are the very same youth that we are concerned around, nicotine and tobacco. But, a 12-year-old can literally walk into any clinic in South Africa and request some kind of condom or sexual advice or intervention without the knowledge to their parents. And it's not saying it's a wrong thing. I think it's just such a big disconnect, a huge disconnect. And then
I just want to pick up on one of the other untoward effects that you hinted at, because I think it's really important we don't drop this. And this is partly as a result of the bad decisions during the pandemic of banning access to cigarettes and e-cigarettes and so on. We know that South Africa has now created one of the most effective illicit markets in the world. The last figures I saw said that almost 60% of the products both on the market are illicit. It's very difficult to put that back into the box without an almighty effort. And I think there are two effects. There's the effect on health, which I think you described very well. And every time you have a ban on vape flavors or vapes, you will definitely be pushing people to smoke more. The evidence of that is crystal clear from the studies done in the US by colleagues at Yale and across the country. The untoward effects are sort of obvious. People will seek out the product in whatever form they can get it, and it's going to be, if it's more toxic or more dangerous, they will go that route. What is compounding it is that the studies looking at doctors' views on what are toxic and what isn't have also got substantially worse. So the last survey of South African doctors about 2-3 years ago showed that 80% believe that nicotine causes cancer and that nicotine causes a range of cardiovascular effects, which it does not. If they believe that, they are not going to be in a position to advise their patients about switching to a nicotine product. They're also not going to be able to advise government, who the government will turn to give good judgment about what is good policy. So I think that whole area is really problematic. The other downside on the illicit side, which we often don't think about, is when I started the work on the Framework Convention at WHO, it was about 2001, 2002, I got called by Alcohol, Tobacco and Firearms which is the federal agency in the US government dealing with terrorism and a whole lot of things. And they wanted to host a meeting at the United Nations to support the Framework Convention, particularly the provisions related to illicit trade. And I thought that was rather exceptional, given that usually the US government doesn't support those sort of UN meetings. And we did have the meeting. And the reason was because at the time, they had uncovered the largest smuggling case of tobacco being smuggled from low tax environments like North Carolina to Canada, and the sales were being sent off to fuel Hezbollah sales. That became one of the very first terrorism cases brought, and an example of how illicit trade doesn't just fuel criminality and bad health behavior, it also has been shown to fuel terrorist activity. And I mention that to colleagues because South Africa is very vulnerable at the moment. You've got ISIS sitting on the Mozambique border, all the way down Africa. I have no doubt that some of the funding must be going off to fund nefarious activities, not just the criminal element, which is bad enough in itself. And all because of bad policies. You can't raise the tax price beyond a level you can measure when you're likely to be spilling over into illicit trade. The ideal should always be to regulate proportion to the risk and to make sure that the products with the best life-saving potential are the ones that are most affordable, most easily accessible to the widest population. We're not seeing that. We're seeing the opposite actually happen.
And it's very concerning. Hence my phrase, public health malpractice. The policies and just the the confusion around nicotine and whether it causes cancer. I mean, it shouldn't be confusing at all. I mean, the doctors should know that they've used nicotine replacement therapy since the late 80s, and that's nicotine. It just the logic just. This disconnect is really concerning. So I have I know it's all doom and gloom and all that, but I do believe that consumers, particularly pretty much all consumers, are looking for the best deal, and the best deal, whether it be rand and cents now, or whatever would be good for them in the future. And I believe that if a product is provided to them that is acceptable, affordable, and more importantly that it's appealing, that they will automatically make that switch. And we see in places like, for example, in Australia, where the policies have been absolutely horrendous, how 96 to 98% of the people that use electronic cigarettes and vapes are buying these products off the black market. And it's rather concerning that we actually now thinking that the black market is better for public health than the regular market. It's rather a disturbing thought. Where do you think this is going to go to, Dr. Yach? I mean, given your years of experience in global health, where do you think this is naturally? When is that straw that's going to break the camel's back going to occur? And what do you think is going to happen? Is it just because there's going to be just too much data to deny? Or is it just going to be, a deal like the Master Settlement Agreement in the United States kind of thing, where it's, okay, it's now accepted? Where do you think this is going?
Yeah, I have times when I'm supremely positive and optimistic, and times when I'm not. And I think at the moment we're somewhere in the middle. I mean, let's remember that there are countries like South Africa where they've gone close to bans on e-cigarettes, and what has happened is fueled massive illicit market. I think of Brazil, for example, and a number of countries. And I also then looked at their number where they're reversing bans and starting to regulate. I think a lot of it depends on actually some of the efforts of the incoming new administration, the US administration. Frankly, if they were to be pushing the FDA representatives to be far more forceful about talking about the science they're relying on for their regulatory decisions in the US within the COP and the related meetings of the Framework Convention, that could have a huge impact. the US also has enormous influence through their medical missions around the world. So they have medical emissaries and attaches in the South African office, in China, in India, and a number of significant countries. In the past, those folk, attaches, have been very important in carrying the message of what's working in the US. And again, I think it's a chance to say, instead of encouraging the nonprofits to carry the disinformation about this causing massive youth risks, they should be encouraging them to carry the message that the FDA is saying this can save the lives of many of your adult smokers. That's one set of trends. I think the other big set is that I mentioned earlier that when you have China, home to the manufacture of half the cigarettes in the world and 95% of the vape products in the world, looking to them a little bit more carefully we're likely to see the change coming increasingly from them. I had a chance to be in Shenzhen last month at a meeting of all the major vape manufacturers, and then had a chance to visit a lot of the factories and offices. And the first thing that struck me was the deep seriousness with which the leading companies are approaching the issue of vape quality, addressing issues of youth access, looking at the issue of quality controls, looking at the long-term health effects, having some of their own products licensed, not just going through the big brands, and they are the manufacturer of all the big brands, which suggests to me that there will come a time when that voice will become even more effective. Given that South Africa is already part of BRICS and China is a key component, one would hope that within that environment, there would be a start of a discussion around what do the Chinese know about these products that's leading them to regulate them, not perfectly, but allowing the growth of the largest industry in the world to be in Shenzhen. What are they doing that we don't know about? How can we learn from that? The same is now happening in the Philippines. We expect that we're going to start seeing the same change happening in Indonesia. These are all very big countries. And take that with the US. If the big countries are moving in a direction that seems to be generally positive, eventually South Africa will have to get their act together and realize it's in their best interest to do the same. Luckily, I think you've got a number of manufacturers present in the country who are trying their best. I would hope that Bloomberg in time will go wary of his campaign. I'm not sure that he's going to put massive amounts of new funding into more of these disinformation campaigns. Hopefully he'll focus on where he is having some good, and that is addressing things like cardiovascular disease and cardiovascular risks, or preventing drowning, a big issue in many parts of the world, and many other public health issues. If there's a relaxation of the NGO and the philanthropic world, that'll also make it important. And then, frankly, the indigenous research groups, particularly the MRC, has a real responsibility to ask, how could we actually make more progress on ending smoking? There is a new MRC president with a solid background in medicine from the University of Cape Town. One would hope that as part of his new brief, he could actually call for a review. And there are plenty of ways it's been done. Think of the Royal College of Physicians in the UK would put together people. Well, why can't we have the South African MRC and the Royal College of Physicians share notes and put together a scholarly group and come up with a decision on how do we end smoking in the fastest possible way, knowing that the whole range of harm reduction tools must be part of the strategy. So I think there are many options, and many of them are not unrealistic. I mean, I start seeing them moving in the right direction. And we are starting to see pretty sharp declines in combustible use in the countries which are switching fastest.
Yeah. My hope is that in the new administration, which is going to be announced or is changing soon in the United States, is a strong focus on the slow-moving PMTA process that struck the FDA. And I've never understood, if the FDA approved, let's say, 10. I mean, there was 34 vape products that they approved, and they've just recently approved 20 nicotine pouch products. Why aren't they using the similar process of substantial equivalence like they used for cigarettes? You know, how vast the difference are these products if you take one product to another product, and I think the PMTA had over 1 million submissions for e-liquids. You know, why
No,
can't they
you're
use
absolutely right.
why can't they use substantial equivalence to say these products, if they meet certain criteria, are automatically meet the same output?
No, yeah, and I think that's where the Chinese could teach us a thing or two, because they've developed their product standards that apply. If the same company is manufacturing the vape that's used by Enjoy or BAT or PMI, or the same company, it's the same high quality of standards, and they have the oversight required. Surely the FDA could be doing the same. You're absolutely right, and that'd immediately mean that a whole class, particularly in the vape and nicotine pouch area, where it's not that
Yeah,
complicated,
yeah.
nicotine pouch even less complicated. You do want to protect basic safety standards. You want to have high levels of quality control, as you do with any consumer product on the market. But to just allow to have these delays of 4 or 5 years that we've seen on some of them is just unacceptable.
It's absolutely nuts. Dr. Yach, I could go on forever and ever and ever. It's been an absolute pleasure and a great honor to have you on the Pack Breakers. I'm really looking forward to one day getting to shake your hand and to thank you for all the efforts you have done over your career. I really thank you for some of the messages that I've heard you say at some of these meetings, and I'm looking forward to having you share your insights and your experiences at other meetings that would occur within South Africa, and hopefully someone picks these up and then has that aha moment that, listen, we've got this wrong. We need to open up the doors, invite people to the table, and thrash it out to ensure that we actually achieve the goals that we've been set out to achieve, and that is to reduce non-communicable diseases. And as you said, the biggest one being smoking. So thank you very much, sir. I really do appreciate it, and you have a good day.
Thank you very much, and thanks to all of you.